Now, the ANC has committed to allocating the same amount of time for each discussion during its policy conference. Discussions on gender equity and the emancipation of women are back in the spotlight. Following a number of things, the success of Banyana Banyana at WAFCON is one of them, and of course the persistent issues around gender-based violence. Let's unpack this story now. Bring in Professor Amanda Gouws, who is the South African Research Chair in Gender Politics at Stellenbosch University. Prof, it's great to have you with us on the program this morning to talk about what is perhaps one of the biggest issues facing our country today, the levels of gender-based violence. And it's ironic, isn't it, that on day one of the policy conference, the gang rape of those 8 women takes place in Krugersdorp.
Yes, indeed. And I listened to the president yesterday who said that we have another pandemic and it's gender-based violence and we have a crisis. Well, the problem is that we've been in this crisis for years and that the state keep on saying it's a crisis, but there's no really dealing with this crisis. And, this is a highly abnormal society where young women in the broad daylight get raped, gang raped. So no woman is safe in South Africa. So the issue here is that, if we look at the policy document of the ANC, it's couched in very abstract and vague terms. So it doesn't talk about, there's a section, for example, on the state. It doesn't talk about the gendered aspects of the state. So we need to look at what state capture did to the state. There were structures in the state that were supposed to promote gender equality. All those structures have been rolled back and hollowed out. And in its place, we have a Ministry for Women, Youth and People with Disabilities. Now, it's the mandate of that ministry to implement a national strategic plan on gender-based violence. We don't know to what extent that plan has been implemented. But if you listen to conversations by people working on gender-based violence, then it seems to be the case that there's a problem with the funding of the plan. The plan is very victim-centered, so that is going to cost us money. And so not a whole lot is happening. During last week, the Ministry for Women had a consultation meeting with stakeholders, and I attended that meeting. And even though it was about a 2-hour meeting, there was a short discussion of what provinces had to do about gender-based violence. The rest of the conference was actually looking at hygienic products for women, so sanitary pads, and how that can be, manufactured at a better cost, how it can be distributed, and so on. Now, while that's important, and nobody will deny that that is important, we need to have also far more a holistic view and strategies to deal with the very huge problems of gender inequality, poverty, and how the feminization of poverty actually hits women harder than men. How we're dealing with the joblessness of young people, including young women. So we can't just stay on what we call practical needs like sanitary pads. We have to have a much broader view. And I don't see that view coming out of that ministry.
Yeah. Prof, as you talk about the gendered nature of gender-based violence, the power dynamic involved in gender-based violence, it makes me think about what ANC NEC member Lindiwe Sisulu said, I think it was just this week, the proposal to back chemically castrating male rapists, which is something that the Women's League may bring back to the policy conference this weekend. Does that speak to, again, the lack of understanding of the issue of gender-based violence in our country, because it just waters it down to an issue of excess testosterone?
Absolutely. It's such a misguided view. And the ANC Women's League idea of rapists must rot in jail. The problem is when you deal with people and perpetrators, it already means that crime has been committed. So it's not preventative. And, if we look at, for example, gender-based violence on campuses, it resides under the Higher Health Committee. It's not a health problem. It is a social problem. And as long as we don't change men's attitudes towards women, men's entitlement to women's bodies, the brutality that men exercise on women's bodies, we're not going to make a dent in this crisis of gender-based violence. We cannot deal with every rapist one at a time after the fact. And, that's not the solution. So there's a very misguided idea, and there is a very limited vision of how we're going to tackle this as a societal problem. I mean, the brutality that's meted out to women is really a crisis. And we cannot, all of us, women, we fear on a daily basis that something is going to happen to us. And this is not a normal way to live.
So how do we move the dial, Prof? How do we move away from, as you say, responding to the issue of gender-based violence every time there is a shocking incident that happens in the country? Tshegofatso Phule's murder comes to mind as well. The man who orchestrated her gruesome murder, shot at 8 months pregnant, hung from a tree because, according to the judge who handed down that life sentence to him yesterday, she was an inconvenience to him. So we're shocked in the moment, we respond in that moment, but then nothing substantial really happens.
Now, this is the lack of the long-term vision and, the implementation of the National Strategic Plan that I've already mentioned. The issue here is that the state needs to consult experts who work with us, social scientists, medical doctors who work with the violence after the fact, sociologists, political scientists, who spend a lot of time doing research on this. I don't see that consultation. So the Department of Higher Education has a task team of experts looking at gender-based violence on campuses in South Africa. It's been nearly 5 years, and nothing has come out of that task team. So what is the point then of appointing experts and task teams, and nothing comes out of it? So I need to ask about the political will. Where is the political will to deal with this? I mean, we have a crisis in many dimensions. And so, gender-based violence is just one of them. But all these crises together is going to make for a really, really uncomfortable going forward for the ANC's elective conference, because in recent research I've done, I've looked at trust in institutions. And the all-time low is in Parliament and the police. So what does it tell us about how citizens feel about the governing party? If the trust is below 30%, it's clear that citizens do not trust that the government can help them.
Because a lack of policy, Prof, is ultimately a threat to the lives of South Africans, in this case, a very real threat to women in this country.
Well, I'm not so sure it's a lack of policy and a lack of legislation. It's the lack of implementation. There's absolutely no will to implement very good policies. I mean, we've had for years the Victim Empowerment Program that's part of the Sexual Offences Act demands that police stations have Tutuzela care centers. So these are one-stop centers where, if you've been raped, women report to these centers, they do the statement, they get the rape kit done, they get counseling, and it's all being dealt with by a women police person. So if you look at the implementation of the Tutuzela care centers, they are actually, it's a small percentage of police stations that have Tutuzela care centers. We have to bolster the sexual offences courts, where the conviction rate in sexual offences court for rape is over 80%. In normal courts, it's 7%. So you can see the difference it makes.
Yeah.
But, the funding, the staffing of all these necessary institutions, it's just not happening.
Yeah. As you say, the policy is there. It comes to the implementation stage where we fail. Professor Amanda Gouws, thanks very much for weighing in on an incredibly important discussion. The South African Research Chair in gender politics at Stellenbosch University. Thanks very much
Thank
indeed.
you.